I'd like to introduce you to a real innovation in terms of dry eye communication between clinician and the patient. And how do we improve that communication? Most of our communications are with smartphones. So SBM Systemi has actually created an app online for smartphones and iPads to enable us to communicate as clinicians the outcome of the examinations undertaken with IDRA, the diagnostic platform for dry eye. So the first part of that process is for the patient to download the app, but it is only activated when you go into the clinic setting. The confidentiality is assured because of a unique, customized approach to dissociate the patient from the outcome from a confidentiality point of view. Sharing of information can be in both directions. The patient can access the outcomes of the examinations when they go home, but first of all, it has to be activated whilst they're in the clinic setting. When they're in the clinic setting, it also offers the opportunity to use the DEQ5, the questionnaire, the symptomology test, before the patient actually is sat in your chair as a clinician. So it saves us time in a clinical setting. It also helps to provide that information in a very appropriate way, a very convenient way for the patient. It drives compliance because patients can be notified of the treatment regime, the drops that are recommended. Maybe this is just ocular lubricants. Maybe it is their prescribed medication. Or maybe it's actually that they're due for another treatment within the clinic setting. The pop-ups on the smartphone allow that patient reminder mechanism to improve that compliance from the patient's point of view. But it also shows that the clinician, the practice, the clinic is interested in the welfare of the patient. So it drives that loyalty to the clinic and the loyalty to the products that are being recommended. All of this is done with the convenience of the natural information gathering component which the patient carries around with them day in, day out, which is the mobile phone. So this is a true innovation, very patient orientated, provides patients with a wealth of information to improve the care of their eyes.